our very own Dr. Tan Mopin. Okay, so Prof. Tan will be speaking on applying the science to address faults. So a little bit about Prof. Tan. Prof. Tan Mopin is a professor of geriatric medicine at the Faculty of Medicine, University Malaya. She has led and completed randomized controlled trial of faults called the Malaysian Faults Assessment and Intervention Trial, and is currently principal investigator of the IIRG-funded Life After Falls study. She set up the Falls Clinic at the University of Malaya Medical Center and heads the Hospital Falls Committee. She is an associate editor for Frontiers in Public Health, academic editor for PLOS ONE, the medical director of Managed Care Sendirian Berhad, and founding director of Act for Health Sendirian Berhad, a University of Malaya spin-off. Her determination to pursue advancement in falls management has led the organization of the first World Congress on Falls and Postural Stability at the KLCC and is a member of the World Falls Guideline Development Committee. So without further ado, on to you, Prof. Tan.
Thank you very much, Kitara, and thank you very much, everyone, for spending a Saturday afternoon with you. We're very touched, and we will do our best to actually show you what we actually have in store, and this is hopefully only the humble beginnings of something that will be a front runner what will be a front runner in providing proactive preventive healthcare for our older people. So basically, our vision is that with the end of the pandemic, we get to reset. So things that we weren't happy with when it comes to the quality of care of people, older people, and how we tend to respond to illnesses rather than act before something happens, will be a thing of the past because we are going to make a difference. So I'm going to move on now with my presentation. Okay, falls. Okay, of course, at the moment, a lot of us wish we were at a waterfall. While we can cross state border, many of us actually prefer to hold back, but many of us are actually at a waterfall this weekend. But what I'm talking about is not a waterfall, but falls older people. So we know that human beings are very special creatures. We actually have to be able to stand on our own 2 feet and stay upright. And do you know that very few other living creatures, living things in this world are actually able to do the same thing? So by being able to stand on our 2 feet, we actually leave our hands free so that we can actually do a lot of things with our hands. And therefore, human beings, the Homo sapiens, are actually in control of planet Earth because of this very special gift. But the mechanisms by which we can stay on our 2 feet are very, very complex. So, and if anything goes wrong with that mechanism that allows us to stay on our 2 feet, we will fall. So why does the older person fall? Okay, so there are loads of things that can potentially lead to an increased risk of falls in the older person. It can be something wrong with their brain. So we all know that older people are more likely to have strokes, and they're also likely to develop dementia or memory problems. And some older people get Parkinson's disease. But as Hasif alluded to just now, older people might also experience a lower blood flow to their brain as the result of low blood pressure or a problem with the heart. Sometimes older people might actually have problems with their eyesight. And the most common cause of a problem with the eyesight is actually not wearing glasses when you need to, or not having the right glasses. But next comes cataract. Malaysia is a very hot country, so with our exposure to sunlight, especially if you worked outdoors as a younger person or spent many hours outdoors, increases the risk of getting cataracts. And many of our older people have cataracts, and not all of them are willing to have operations. Not all of them can afford operations, but many of them are not even aware that they have cataracts. Um, the other one is glaucoma. It's a very silent problem. Um, and that gradually reduces your eyesight. And it's only when you finally get it tested that you realize that you've lost all your peripheral vision and you've now only got tunnel vision. Glaucoma is rather awful. It's very silent, and people do need to screen for it. The other thing that happens that we don't currently have a cure for is scarring at the back of the eye. We call that macular degeneration. So older people might also have problems with their hearing. Not all of them will have problems with their hearing, but as you get older, you might have more problems with your hearing. But the ears are also responsible for balance. So we have this organ inside our ear called the semicircular canal, and those might be damaged, and the likelihood of them getting damaged increases as you get older because you've been around longer. And then with the damage to your balance mechanism, you are more likely to fall. The other thing, as I mentioned earlier, is if you're not getting enough blood to your brain. And that happens because of either a problem with the heart actually pumping. So, and in order for the heart to pump, it needs to get electricity. It can't actually needs electricity to pump. So if there's any problem with the electricity wiring, or any problem with the muscle of the heart, or any problem with your blood pressure, if it's too low, then you end up having falls. And older people might also develop weaknesses of the muscles, and end up needing help with walking. So often they use a frame, but that means that if they have an external insult, like if they trip or someone accidentally shoves them, then they lose their balance and they can't right themselves and they fall. And bladder issues are also very common in older people, and because they're having to rush to go to the toilet, they might drink less water because they don't want to go to the toilet, and that leads to a low blood pressure, which increases the risk of falls, or they actually fall because they're rushing to the toilet. And a lot of older people also get arthritis, and this is actually quite disabling, and can actually lead to a lot of falls, but it is treatable, usually with exercise and painkillers, but sometimes you might need an operation. Okay, and unfortunately, many older people take a lot of medications, and medications have side effects. This includes drowsiness, mental confusion. Some medications give you blurred vision or dry mouth, and then some medications lower your blood pressure or slow your heart rate. Some make you feel sick and you end up vomiting. Some give you a reduced appetite, and some people have get gastric ulcers, especially if you take aspirin or painkillers. A lot of medications make you very constipated. Some medications causes bladder problems and leads to incontinence. And quite a lot of medications also make your muscles weak. Many of us don't know that. And a lot of doctors will prescribe medications and not necessarily have enough time to actually inform the patients about all the side effects. So that's where we hope to come in that if you do suffer a fall, or if you feel that you are at risk of falling, we can actually provide a review of all the medications that you're taking and try and take away the ones that could increase the risk of falls. And unfortunately, a lot of our older people were born during lean times, during the Second World War or during the communist occupation. And many of them lived through the May 13 emergencies. And so they're used to hoarding. Unfortunately, at times of plenty, hoarding behavior then can cause a lot of clutter around the house, and a lot of dangers, we call them, home hazards. So this is actually my uncle's house, and he fell and broke his hip, and he normally never allows anyone into his house because he doesn't want to tidy up. And this is what, to our horror, we found: hardly anywhere to walk and pieces of paper all over the floor. No wonder he tripped and fell and broke his hip. Okay, and a lot of older women still like to wear high heels because it makes them taller, makes their butt stick out a little bit and make them rather sexy. So, but high heels and other inappropriate footwear such as bata slippers and broken slippers or ill-fitting shoes are all increase the risk of falls. Whoops. Too fast. Okay, so these are three of the commonest reasons why older Malaysian falls, and this is the results of our own very own Malaysian research. The number one cause of falls in Malaysians is actually the medications that they take. Malaysia is very unique in that we can very easily buy medications just by visiting a pharmacy. And we can access a doctor by just making an appointment with no gatekeeping. So as a result, a lot of older people end up on more medications than they need. And because different doctors prescribe different medications, no one is actually in charge of the big picture. So many of our older people we find who actually have falls, that's 4 out of 5 of them, seem to be taking far too many medications, especially medications that increase the risk of falls. But of course, these risk factors are not isolated. A lot of older people actually have multiple risk factors. And sometimes it's not just medications, they're also on inappropriate medications, and they are unsteady because of muscle weakness at the same time. And so the number 2 cause of falls in Malaysians is actually balance and walking issues. And the third most common cause of falls is low blood pressure. That's why we're asking people to measure the blood pressure standing, because the blood pressure might be normal when you measure it sitting down at the doctor's, but when you stand them up and measure the blood pressure immediately after they stand up, you find that there's a drop. And this can be caused by medical problems such as diabetes or Parkinson's disease, but most commonly it's actually caused by medications or not wanting to drink because they might go to the toilet too often, or sometimes more sinister causes like active bleeding from an ulcer or bleeding from other internal bleeding. Okay, so as I mentioned, risk factors coexist. So a lot of our older people fall not because they've just on too many medications. They fall because they're on too many medications and they have poor balance, or they feel dizzy, and all this added together amplify the risks of falls. Okay. So, and what we also found is that 1 in 6 older Malaysian fall at least once a year. So falls are very, very common. And what happens after the older person falls? Well, usually this happens in the 60s. In their 60s, they might be taking some blood pressure medications, and then on a hot day they've been standing now around for a bit, and then the blood pressure drops because they're dehydrated, and they fall down, and they have the reflexes to put their hands out to save themselves, and so there's too much pressure on the bones, which are becoming a bit thin because of osteoporosis, and this is a picture of a wrist fracture. So this is the wrist joint. That's the radial bone, the radius, and that's the ulna. And as you can see, there's a clean fracture, a clean break from the radius in the head of the radius, or the proximal shaft of the radius. And this is what we call a wrist fracture. And it's the first sign that things are not right, in that the older person might be at risk of falling again, but also having osteoporosis. The next thing that happens if someone has a wrist fracture and no one had screened for osteoporosis or false wrists, the next fall could then lead to a vertebral fracture. So this is X-ray of your spine. Okay, and so the spine basically holds the spinal cord inside and keeps it very, very safe. Okay, so there's a hole in all these bones that act where the spinal cord runs through. But as you get older, even though these things are supposed to be very strong, solid bone, it actually gets thinner and thinner. And with a lot of, if you fall and you fall on your bottom by then because your reflexes are a little bit poorer now, you don't put your hands out to save yourself, then what happens is there's a crush fracture and the bone actually squishes, and we call this a wedge fracture. Okay, and then you see the older person becoming more and more bent. Yeah, we call it scoliotic, and that's a sign that they've got osteoporosis of their spine, and eventually the whole spine will crumble and they'll become very, very bent. Finally, if nothing is done about this, then what happens is eventually in their 80s, they might fall and suffer a hip fracture. So in this unfortunate older person, this is an x-ray of the hip joint. So what you have is the pelvis, yeah, the pelvic bone, and that's a left hip, and this is a right hip. And what you can see is this is a normal hip. The bone is nice, the joint is nice and clean. There's a ball here fixed onto the socket, and this is the shaft of the hip of the femur. Okay, and it's nice and clean, no breaks. But when you look at the right femur, there's actually a clear fracture at the head of the femur, and you can see some bony shards sticking out because it is broken. And to fix this, it's very difficult because it's the biggest joint in the body. It's a weight-bearing joint. All the doctor can do is take the top bit out and put a prosthesis. That means a new part where to replace the bone, the bit that they've taken out, and hope for the best. And so a lot of times, 1 in 4 older people are unable to walk anymore, and one in 5 or 1 in 6 actually are no longer alive at 1 year after a hip fracture. So this is actually a very disabling and very deadly problem in older people. And one of the things we strive towards when we treat falls is to actually prevent this fatal incident. So this is a bleed in the brain. We call it a subdural hematoma. So it's a CT scan. Yeah. So the person's in the CT scan tunnel. It's not a tunnel now, it's a polo mint. Okay. So you go into this giant polo mint and you're there for about 5 minutes and they get these lovely slices of your brain. They don't really cut up your brain. It's just the computer is so clever that they can actually interpret the x-rays that go through the brain and create this image. So in this image, it's actually slicing our brain through this side, okay? And so you have the ventricles, that's where all the brain fluid is held. And then this is a right brain and this is a left brain. And you can see that is actually what we call it a filling defect on the left brain that is actually less dense than the brain itself. So we call this a hypodense filling defect, and it's consistent with a subdural hematoma. That means a very slow bleed into the brain that has happened because the older person's brain has shrunken. So when they suffer a fall, the brain actually shakes in the head. And because the veins in the subdural area are very thin-walled, so this shearing forces of the brain shaking inside the skull will tear these veins, and then it leads to a very slow ooze. So the person go home already. Sometimes they even do a CT scan within 24 hours. It's normal. Person gone home already after they gone to the hospital, and then a week or two later, the person starts falling down again, or becoming unsteady, or becoming confused. Do another scan, and you realize that they have a slow bleed into the brain, and then the surgeon will have to go in and make a hole to relieve the blood clot. But sometimes the bleed might be too severe, in which case it could be fatal. So very scary, this stuff. But thankfully, this happens to less than 1% of falls, though we probably overestimate the risk of this one compared to a hip fracture, and we do way too many brain x-rays and probably not enough hip x-rays. sorry, brain CTs and not enough hip x-rays. But this is actually what we are most afraid of after the older person fall. They don't want to move. We call this fear of falling. So, and the fear of falling is, we call it pathological. That means actually very disabling. Because in an Asian context, it's not just the older person who is afraid of falling, it's the whole family and the whole of society, all their friends in the hospital. So because once the older person falls, people picture this, all these horrible things of the brain bleeding la, the hip fracture la, that they would don't want an older person to move ever again. So it is actually disabling, because if the older person does not move, the muscles will waste away, and next time wind blow also will fall down, and they really have no hope. So we call this a downward spiral of deterioration, and before long, if you don't do anything about this, they go beyond the point of no return, just like in the Phantom of the Opera. Okay, and then this is what happens. They become disabled and they need care. They need care in a care home. Um, Even though we don't have anything against care homes, but one of the missions of anyone looking after older people is to actually hopefully prevent them having to go to care. Because some of us might need care, and some of them want to be in a care home, but they do cost money, and if you don't have to be and you can remain independent, why not? And sadly, this is statistics from the University of Malaya Medical Center itself. 1 in 5 older persons who present to the emergency department after a fall is no longer alive just after 1 year. Falls are deadly. So what can we do about it? Is it all doom and gloom? Do we, once fallen, do we just kind of sit and wait? Well, I hope not. Okay, so this is the hope that we're hoping to bring to the Malaysian society, and this was the first randomized controlled trial that I embarked upon my return to Malaysia from Newcastle upon Tyne in the UK in 2011, but the trial started in 2012. Okay, so what we did was we recruited individuals aged 65 years and over who has had 2 falls in the past 12 months or 1 fall with injury, and then we gave them individualized therapy. Okay, so individualized means the person only gets what they need. Okay, and so what we did was we checked their balance, looked at their medications, and if they had a fall at home, we sent our occupational therapists to their houses to check out for all these potential environmental hazards. They all had a eye test, and those who had cataracts had early cataract operations. Those who need glasses, we actually sent to actually get glasses made. And then, so of course, we found some glaucomas that were treated as well and prevented some people from going blind. We also did lying and standing blood pressures and checked people's heart out, put a couple of pacemakers in, but a lot of times we just changed their medications. We gave them a lot of psychological encouragement to remain active after the fall, and we gave them Otago exercises, which is actually a set of exercises invented by the late John Campbell from the University of Otago in New Zealand. And these set of exercises we now deliver regularly to our older fallers, and they have been found to be effective in reducing the risk of falls. So, and what we did after my fate was to actually come up with another study called the LIFE study. So in the LIFE study, we actually looked at physical activities after a fall. So what we found from the My Fate study was that a lot of our older people who actually, after a fall, don't seem to move anymore. Okay, and we wanted to know what were the factors that stopped them moving after a fall. So that's why we applied for funding for the LIFE study. We also wanted to know in more detail what happened to the heart rate and the blood pressure changes, and also look further in how we can actually build homes that are safe for older people, such that if they do fall, they are not going to stop moving again. And also if they do fall, we can actually modify to actually stop them falling again. We had some really interesting pictures of homes, very, very interesting indeed. And unfortunately, in the middle of life, COVID happened. And but with every challenge came great opportunities. So all of a sudden, we realized that we had to go virtual. Okay, so we were able then to develop assessments of someone's mobility, memory, blood pressure, psychological well-being, and also their social participation entirely on the computer. So we've also developed virtual assessments thanks to COVID. And what thanks also to COVID, it's accelerated our expansion into a center called Act for Health, which is located in Section 19, just the other end of what is now called Jalan Ungku Aziz, and formerly Jalan University, from the opposite end of Jalan University, from the former Jalan University, from the University of Malaya Medical Center. So very near where home base, but actually accessible in terms of ground floor, front door access, disabled toilets, and the best thing about this is actually smart Selangor parking and a car park that is open air and within easy reach. And this car garage over there gives us a giant ramp where anyone with even the biggest wheelchair, because it's for cars, it's built for cars, can actually come up and get into our center. So very easy to access. So and in this center now we are commercializing our products in false risk assessments, which can be done virtually and as well as in person, whichever you prefer. Okay. Um, and for those people we've actually found to have problems with their balance, we would actually recommend the Otago exercises that will be delivered in our center. And also for those who fell at home, you can also subscribe to a home hazards assessment in your own home. Either if you prefer our occupational therapist to visit you, then home visit, or if you prefer them to just look from outside virtually. So thank you very much for listening, and we hope that you will be interested in subscribing to some of our false services. And please tell everyone who's had a fall or who's afraid of having a fall or at risk of a fall about us, because we want to be there for them. Thank you.
Thank you very much, Prof. Tan. So I think we have a question in the chat box by Sharifa Tahir. Where do falls usually take place, indoors or outdoors? In homes, which section of the house is most common?
Okay, yeah, thank you for that wonderful question, and it's very important. For the older Malaysian, the most common place to fall is actually inside the house. 60% of Malaysians fall indoors. Um, it's not because it's not because our houses are dangerous, but maybe they are. But it's because they don't go out, because outside is dangerous. So there's a lot to do to get our older people going out. And one of the psychological things that we do to our patients who fall is to actually say to them, you must not stop going out because you fell inside the house. Yeah, it'll be safer if you fell outside. People can see. If you fell at home, nobody knows. Yeah, and then the other thing is which sections of the house is where most commonly where people fell. Yeah, there are two places actually: the bathroom and the bedroom. Yeah. So older people have the most risk. I mean, considering how much time we spend in the bathroom, though I do question how much time Malaysians spend in the bathroom. But the bathroom we tend not to spend so much time, but it's actually a very common place to fall because we love wet floors and we don't like to spend money on non-slip tiles. So there's so much we can actually do to actually improve the safety of our Malaysian homes. The other thing is the bedroom, and this happens because the older person gets up too quickly, and then there's a rush of all the blood to their legs, so not enough blood going back to their head, and then they topple over. So there's a lot of things to do there. The occupational therapist might actually recommend safer beds, where they can actually get up in stages from. The other thing is the flooring. So if they do fall, the flooring should not be hard concrete floors, maybe a bit carpeted. I know carpet, right? Yeah. So the other thing is but a softer flooring would be more conducive in the bedroom if you do fall. Trust me, yeah. So, but don't put a loose rug, proper carpets. And then the other thing is lighting. Yeah, so enough lighting, and then uh, check your check your medications, particularly blood pressure medications, and take the blood pressure medications at the right time, correct time, and also enough water, drinking enough water, especially if you've been to bed all night. You have to drink more water so that when you get up, you don't drop your blood pressure. Okay, so there is another question. Right? 1 in 5 will fall. Oh, okay. So 1 in 5 people who actually attended the emergency department after a fall, yeah, actually died. Most of them, of the health condition is numerous, of course, and a lot of our older people have memory problems, have osteoarthritis, have a muscle weakness, and when we didn't look at the same group, but when we did another a separate study in the My Fate study, we brought these people back. The medical conditions that were most likely to be associated with falls were diabetes, high blood pressure, heart disease, strokes. But we're not actually interested in the medical conditions as such. We're interested in the risk factors. And as I mentioned just now, the 3 most common risk factors in older fallers in Malaysia: medications, gait and balance, and low blood pressure when we get up. Okay. And how do you access the findings? These are all published. Yeah. So we will be able to share our publications. Is that right, Nina? Yeah. Okay. Yeah. Thanks for asking. But we are very lucky because our My Fate study was published open access, so you should be able to access it.
Okay, thank you so much, Prof. Tan. I think there were some previous questions pre-webinar based on our pre-webinar survey.
Mhm.
There were some other questions that were asked.
Yep. Okay. Let me get them out.
Okay.
Okay. Um, they're working me hard today, you know. Okay. Right. Sorry. So you wanted me to answer this question about falls prevention in primary care. Yeah, we very much like to work together. In fact, one of the big missions in Act for Health is, if we only deliver these services ourselves, the upscaling will be non-existent. So the only way we can upscale is to engage primary care, and our intention is to actually come up with training packages for primary care doctors to actually also deliver false risk assessments themselves. So that's one of the big missions of Act for Health. So please watch this space, and it's coming soon to a center near you. Okay. And teleconsultation, that's a very good question. So we are still struggling to actually get to grips with uh, the geriatric input in Act for Health. Because, of course, Act for Health was funded because of the poor access to actual specialist geriatric care. So you don't ever get to a geriatrician until you have multiple medical problems with multiple medical illnesses and you're disabled. So by that time, too late. But why? Because there's so few of us, then we have to be very, very selective. So what we're hoping that the mission of the Act for Health is actually prevent people actually ever needing geriatric care. Um, and um, and it will be an evolving service, because Malaysia hopefully will have more and more geriatricians, and then hopefully the mission and the vision and the role of Acts for Health will change over time in providing assessments for geriatricians rather than avoiding geriatric care altogether. But at the moment we have not got that luxury. So teleconsultation, however, will be offered as part of our services in UMMC. I was just at that meeting yesterday, pleased to say, but you actually have to be a patient at UMMC. Yeah. So, but the whole mission of Act for Health is never to get there. Yeah. So hopefully, and we want the well older people to access this. Okay. And then finally, what's the best way to approach special need senior citizen to understand themselves? Yeah, this is a very interesting loaded questions. Yep. So all there's no such thing as special needs senior citizens because all senior citizens are special. There's no one that everybody is different as you can see, as such that when we deliver geriatric care, we deliver individualized therapy, individualized approaches. But so they're all special. But then, how to get them to understand themselves? That's exactly what we are doing. And thank you very much for asking this question because we are actually wanting to develop these packages that will actually help educate our older people about their problems. So, this, of course, that one needs a bit more work. So, it's not quite being launched today. So, please stay in touch and we'll update you when we can. Oh, okay. I think there's some questions, right, Katara?
Yes, thank you so much, Prof. Actually, there's a question from Nurul Hayati.
Mm.
She says that her mother has Parkinson's disease, and she's thinking about Otago exercise program for her.
Yes.
Do you have the exercise programs done online? And
Yeah.
yes, we do. Yeah. Okay, go
Yes,
on,
we
Prof.
do. And you'll have to stay till the end of this
Yes.
to find out because Nina will be telling you soon. Yes.
Yep. So, anyone has any other questions before we proceed? So, if we have no questions, thank you so much, Prof. Tan, for the very insightful session. Okay, and we shall now proceed to the next one.
Thank you.
Thank you. Which is by Dr. Maya.